Okay, here's everything that happened in medicine and healthcare today, and it is October 6th. Starting us off, we have some news when it comes to vaccines and the CDC, which no longer recommends getting the vaccination of MMR with chickenpox and now recommends having them separately. It also no longer recommends a blanket recommendation for the COVID 19 vaccine and instead recommends having a conversation with your physician in order to determine if it's best suited for you. Before we get into the rest of it, if you want to stay up to date with the latest medical and healthcare news or have any of the links to the studies we're talking about, you can find it in the link in my bio to my Substack, where you can also find some ways to help support the page if you want to help out as a medical student. In the world of liver disease, there was a new study that found that both sugary soda drinks and artificial sugary drinks both raise the risk of having development of liver disease. Specifically, they found that this research was even true even if you consume just 1 can per day raised your risk. A new sleep study finds that individuals are way likely to overestimate how much sleep their children actually get, with the highest discrepancy being in the Latino community by almost 1 full hour, meaning that they thought their kids were getting 1 hour more than what they were actually getting. And lastly, we have a risk assessment out of Canada that found that individuals, especially older adults who had a traumatic brain injury, were significantly more likely to develop dementia. The most important part was that it came after over 5 years and that they were more likely to need things like long-term care and housing facilities. That's all the major news for today. Again, if you want the links to everything or a more in-depth analysis, you can find it in the link in the bio. I will see you tomorrow for the rest of the news.